Hi guys, I'm Manali and this is my YouTube video channel Medical Romance. Please hit the like button and subscribe us for more interesting videos. So today our topic is gonna be the internal carotid artery. So I will first tell you, I will not be discussing about the blood supply to the brain because I'm intending to do a separate video based on that. So today we will be talking about the main branches of the internal carotid artery. So let's head on. First and foremost, I would like to divide the internal carotid artery into four main parts. And then we will be discussing about the branches that are emerging arising from each of those parts. So, the first part will be pars cervicalis. And then the second one is pars petrosa. Now, pars cervicalis, we all can understand that pars cervicalis is located in the neck area, and pars petrosa, that is where we have the temporal bone and the petrosis part of the temporal bone. And then the third one is pars cavernosa, and that is where we have the sinus cavernosus. And then finally we have pars cerebralis. So that's not hard at all. So let's begin. I will be drawing all the branches of the internal carotid artery. First and foremost, as I have already mentioned in another video, the common carotid artery bifurcates to the external and internal carotid arteries at the level of the superior margin of the thyroid cartilage. So here we will have the external carotid artery and the internal carotid artery. Okay, then the first part, pars cervicalis. So we have pars cervicalis. I will write 1. Pars cervicalis, we don't have any branches that are arising from pars cervicalis. So that is easy. And then we have pars petrosa. And here, very importantly, I have to mention, this is the carotid canal. You can write it as canalis caroticus. The carotid canal. And then inside the carotid canal, the internal carotid artery will give this branch which is named as arteria carotico-tympanicae. Okay, then what happens? Here we have the foramen lacerum. Foramen lacerum. Then here I should mention this is pars petrosa. So I will write 2. And then it will go through foramen lacerum and will enter the cranial fossa. And then it will go through the sinus cavernosus. So here we have drawn from blue sinus cavernosus. Okay, inside sinus cavernosus we have pars cavernosa. So I will write 3. And here it gives several branches. So I'll draw like this. It gives several branches. So now we will see what are the branches that the internal carotid artery is giving while it's going through sinus cavernosus. So the first branch will be ramus meningeus. As the word already says, which means it will give the blood supply to dura mater. And then we have rami tentori. So giving the blood supply to the tentorium. And then we have rami ganglionaris trigeminale. Ganglionaris trigeminalis, which means it will give the blood supply to the trigeminal gland. And then we have ramus sinus cavernosi. And then finally we will have arteria hypopophysialis inferior. Which means it will give the blood supply to the inferior portion of the pituitary gland. And then, so that was pars petrosa. Then we will have pars cerebralis. And from pars cerebralis arises the following arteries. Let me use a different color. Okay, something like purple. Okay. And here it will give few branches. Let me write A, B, C, D. Okay. And E. Okay, this A. This is the arteria choroidea anterior. And then we have arteria communicans posterior. Then we will have arteria cerebri media. And then arteria cerebri anterior. And here we will have, this is arteria ophthalmica. And this arteria ophthalmica is going through canalis opticus. And then it will get into the orbit. So this is canalis opticus. When it is inside the orbit, it will give these branches. So let me draw the branches. Okay. First we will have this branch, and this is the supraorbital branch. So I will write one for that. This is arteria supraorbitalis. And then we will have another branch going like this, and here we will have the lacrimal gland, and it will go to the lacrimal gland. So that is obvious. So this is arteria lacrimalis. So I will write 2 there. Then we will have a branch going like this, and then giving 2 branches, and here we have the third one, that is arteria supratrochlearis. And then here this fourth one will be arteria dorsalis nasi. Then again we will have branches, and this will be, we can call it arteria, this is palpebralis, medialis, and lateralis. Okay, palpebralis, medialis and lateralis. So that is 5. Then we will have arteria centralis retinae. So I will write 6, arteria centralis retinae. We will also have branches going to give the blood supply to the extraocular muscles. So I will write it like ramus muscularis, and that is number 7. Then we will have 2 other branches going through these foramens, and this is foramen ethmoidale anterior and foramen ethmoidale posterior. So respectively these arteries will be arteria ethmoidalis anterior and arteria ethmoidalis posterior. And this arteria ethmoidalis anterior will give arteria meningia anterior. Okay, we will talk about that later. So for now you can understand the fact that we have internal carotid artery. It is divided into 4 main parts, and that is pars cervicalis, pars petrosa, pars cavernosa and pars cerebralis. And then in pars cervicalis we can't find any branches, and in pars petrosa we saw there is arteria carotica tympanicae, and then it is going through foramen lacerum and entering to the cranial fossa, and then going through sinus cavernosus and giving some branches, and then finally ending up at as pars cerebralis, and there we had several branches. So I hope that is clear. So let me show you this in an atlas, this last part, pars cerebralis, where we have the ophthalmic artery. So okay, let me show you here. Okay, here as you can see we have arteria ophthalmica going through the orbital canal and entering into the orbit, and then it will give on its way arteria centralis retinae, and then it will give arteria lacrimalis, and we have this arteria ophthalmica continuing, and on its way it will give arteria supraorbitalis, and also arteria ethmoidalis posterior, arteria ethmoidalis anterior, and ethmoidalis anterior will give arteria meningia anterior. And we will also have branches like arteria ciliaris, which is giving blood supply to the ciliary muscles of the eyes, And then we will have muscular branches, ramus muscularis, as I already told you, that are giving the blood supply to muscles, extraocular eye muscles like rectus lateralis and then obliquus superior. So likewise, so there you have the ophthalmic artery. And if you look at here in this diagram, we can clearly see, when I told we have arteria palpebralis medialis and lateralis, here we can see the superior one. So this is arteria palpebralis lateralis superior, and this is arteria palpebralis lateralis medialis. And here we have arteria palpebralis lateralis inferior, and here we have medialis inferior. So likewise, they make two arches, and that will give the blood supply to the eyelids. So hope everything is clear. So that is all about the internal carotid artery. So hope you enjoyed our video. Please hit the like button and subscribe us for more interesting videos. Hope to see you soon.